Now we're recording. Hello. We're going to do a 5-minute chat on chronic pain. Eryn, do you know the definition of chronic pain?
No.
No? I'm telling you the definition of chronic pain. Depends on who you ask. That's why it can kind of fluctuate.
I obviously am not, I don't treat or dive into the area of chronic pain as much as Katie does, but I see pain every day, obviously, in my job.
All the time.
I think generally the definition is like pain lasting more than 6 months that has not followed regular healing timelines for like the particular type of issue that it's been.
That's very good. It's 3 to 6 months depending on who you ask, but basically it is pain that continues to persist potentially despite any pathology or damage, or maybe very little pathology or damage, but that the pain sensation itself continues. And so I think that that's not necessarily something that the general public understands, that you can have pain and there might not be tissue damage associated with it. And so I like to give the example that in like healthcare we hear a lot is something called phantom limb pain. So if someone has had, or phantom limb symptoms, if someone has had an amputation, and I've seen this, I've worked in the amputee clinic before, they'll come in and they'll say that they're, if they had like a below knee amputation, they'll say that their foot still hurts or that it's really itchy. Like they'll have sensations happening in this limb that is no longer there. And so it's like, why can I still feel an itch in that foot? And it's because all of the nerve circuitry and in the brain, the part of the brain that represented that area is still functioning, and so they're getting these phantom sensations. And what's really interesting is that you can put them next to a mirror so that they put their limb in the mirror and they look in the reflection and it looks like the leg that had amputation, and they can scratch that foot and it can resolve the itch that they're feeling. So we know that pain is a very, very complex thing in that the amount of damage to an area might not equate to the sensation that you see. We see this, I think, in chronic pelvic pain and things like endometriosis, because you can have someone who has very severe symptoms of endometriosis, but when a surgeon might go in to actually do the diagnostics, there might not actually be a lot of the disease within, like infiltrating into the pelvic cavity. And so it becomes really kind of this complex issue for practitioners. Well, what can we do when we see that this is happening?
I was just going to say, like, it's not just pain sometimes either. It can be, like, chronic sensations. So, like, I see it with prolapse a lot, actually. So people come in and they'll be like, my, family doctor or nurse practitioner said I don't have a severe prolapse. And, like, from the perspective of how we measure them, that might be true. But just based on where that is sitting, sometimes that can create a lot more sensation to the nervous system, and therefore the patient is more aware of it.
Absolutely. So that's a really good point, is that it's not just, we see sometimes like itching or aching, or people will say like they've got weird tingling feelings.
Funny feelings. Yeah.
And so I always like to think of the body like the tissues where the general population would think injury happens. Like in the muscle, in the skin, in the tendon. And then you've got the circuitry that has to process that information and carry it up to the brain. And I almost think of those like a system of railroad tracks, and within that system you can change tracks. Your track can shift left and right, it can branch off, it can narrow into more or less tracks, and then you get up to the brain, and then the brain is its own thing too, whereas the signals can ping around to many different areas in the brain, and then we have like almost these volume buttons within our nervous system that can either increase that sensation or decrease that sensation. And so that sounds kind of weird, but examples of this would be like an athlete who breaks a bone and they're still able to continue a game without feeling any sensation at all, right?
That's like top down.
Top down, right? Or for me, sometimes there will be like a dog hair stuck in my sock and I will think that there's like a needle going through my foot. And so we know that our perceptions of pain are not necessarily dependent on any actual pathology.
Yeah, and like this just happened to me last night. I saw a snake on my typical run, and I'm terrified of snakes, and snakes aren't dangerous in New Brunswick, but it has made me so jumpy now.
Yeah.
It's like my nervous system is like, just if it's a stick, if it's like a dark area on the trail, I automatically think it's a snake again, and I'm like so jumpy. So
Eryn makes a really good point in that her prediction is off, and it will actually change her sensation. Yeah. And so that's something that we're always assessing in physio, like, okay, how much sleep did you get? What mood are you in? Have you ever had a headache and then like you're around someone that you just don't like, or maybe your kids are being really annoying and it's like all of a sudden your headache is that much worse? And that has nothing to do with
Katie
the severity of my
headache.
Yeah, my colleagues are really annoying today. But your previous experience, right? You might have, just like Eryn said, that same thing can happen with pain, right? So if you've had a low back injury before and you twinge it just a little bit, you're so scared to then have, all the repercussions of that previous back injury that you perceive that as such a big threat. Not you consciously, but like the nervous system perceives that as a threat, and you'll get a heightened response in an effort to protect you. All of this is done to protect you.
And that's what I always remind people of, is like your body and your nervous system is doing a really almost too good of a job of trying to protect you. And so it's like on high alert. And its response is not in accordance with whatever that input or stimulus is. And so we just need to kind of teach it not to jump to conclusions quite as much.
Yeah. What do they always say? That it like shoots first, asks questions later. That's how the nervous system responds.
Yeah.
And so we want people to start thinking about chronic pain more that it's not a direct linear relationship to damage or to injury, but it's a very complex system that's designed to try to protect you. And sometimes we can see all of those different ways that it protects you, and all those different inputs can maybe make your pain persist longer than it should.
And I challenge you, Katie already mentioned this, but like, have a really good night's sleep and see how you feel the next day compared to a terrible night's sleep.
Yeah.
And like, how does that area feel?
Yeah.
And I think that just goes to show so much, like there's so many factors that can impact how we process and manage sensations. And so sometimes there's really important things that can obviously impact that we're not consciously aware of. And that linear relationship between tissue damage and what we feel can be very different.
Yeah. We're going to talk about things to do about chronic pain in our next couple videos. So stay tuned. Bye.